Watch more programs like this on cable and stream with PCN Select. Subscribe at PCNTV.com.
Hello, everyone. Today marks the first program in a special series here on PCN about the impact of coronavirus on Pennsylvania and its citizens. Our first guest today is Senator Jake Corman, Senate Majority Leader from Juniata, Mifflin, Huntington, and Center counties, and he is joining us over the phone. Senator Corman, thank you so much for taking the time today.
Good afternoon, Cass. Thank you.
Now, how will the Senate be operating during this coronavirus outbreak?
Well, specifically right now, we're obviously not in session. We were scheduled to be in session today, yesterday, and tomorrow, but due to the governor's request for desocialization, we did not go in. We do plan to come in tomorrow just for a rule change. Right now, we do not have the ability through our rules to be in session remotely, and so you need a quorum in the building to start business. So tomorrow we'll come in, hopefully, and pass the rule change that if we need to be in session at a future date during this crisis, we will do it through a remote process.
And how would this remote process work?
Well, we're still working out a lot of details on that, but essentially it would be somewhere you could either through a teleconference, phone call, Skype, something of that nature. We're working through those details now. So this is all new to all of us, and so working through the process to make sure we're still transparent, that members of the public, members of the media would be able to listen in or view whatever that might be, and so that we can. But probably, the only business we're going to be doing during this crisis would be business that would relate to the crisis itself. There's a couple areas, whether it be governor needs funds or workers' compensation issues that we're dealing with, or I should say unemployment compensation issues, education issues with the school districts, things like that. We wouldn't be in to go in and just have a normal session. It would just be a session to deal with this crisis.
Will you be having any meetings or hearings during this time?
None planned at this point in time. Some of this process may involve committee meetings, which again we would be able to, through our rule, be able to do remotely. Just to move bills that are maybe necessary to deal with the coronavirus emergency. So, but only those types of committee meetings. I can't imagine we'd be doing hearings. Will
the Senate be looking at what type of legislation will the Senate be looking at during this ongoing crisis, and what bills do you foresee coming to the Senate floor, whether it be virtually or whether you're in session?
A couple areas specifically that may cause us to need to pass some legislation. With this, with all of these mandates, employers shutting down, employees not working, there may be some unemployment compensation issues that, part of that is, it's mandated to, they need to go search for work. Well, we don't want them going out searching for work right now. So things of that nature and unemployment comp. Right now, between the president's declaration and the governor's declaration, they have a lot wider powers than they normally do in the executive branches. So we're not 100% sure necessarily we'll need something, but that would be an example of an area. In the education code, at some point, we're probably going to look at relieving the school districts of their 180-day instructional mandate. The governor, through Secretary Rivera, I think, has already said that they would not be punished, if they did not do it. But we may need to do specific language to relieve them of that mandate. There may be funds that the governor needs, which obviously the legislature appropriates. Or ability for him to move funds around to deal with this emergency. So those are just some examples of areas that may require us to be in session.
So how are the Chamber of the Senate and the Chamber of the House working together with the governor to come up with this legislation so that, Governor Wolf can move funds around if he needs to?
Well, again, we're asking the governor. We're constant contact with the governor, the executive branch, Secretary of Health, Secretary of Education, DCD yesterday, there may be some areas there for these businesses are hurting that may call on us to do some legislation. So we're in constant contact, trying to work together in a bicameral, bipartisan way to react to this emergency. And, again, I don't think you'll see us pass any controversial legislation. I think it'll all be legislation that basically would get unanimous support to help in this battle. So, we're working closely with our friends in the House and the Senate Democrats, and as well as the governor. We want to give the governor, and the Secretary of Health or the other departments I mentioned all the tools they need to deal with this emergency.
What have been some of the thoughts of your fellow senators about being in session?
Well, like everything else, people were concerned. The governor's asked us all the health experts have asked us to desocialize, to not be large groups. And so, we want to take the proper steps to make sure if we are in just for a very short period of time tomorrow that we've done all the proper mechanics of the building to make sure that it's safe for the members to come in. My guess is there won't be a lot of handshaking as normal. But we are taking all the proper steps to make sure that it's safe to come in tomorrow, if we just deem it necessary to come in tomorrow, and then again, if we need to meet in the future during this emergency status, we can meet remotely.
Have there been any changes in how your Capitol office and how your district offices interact with your constituents from your district?
Well, there's some changes. Clearly, our Capitol offices are closed right now. Obviously, that short of a sports arena, I'm not sure of another place that has more employees or more people walking around than the state capitol. And so clearly, we don't want to be in groups of large people. So they are working remotely from their homes. Our district offices, every member is different, but my district office is not taking walk-ins and appointments right now. Again, answering the phones, answering emails, because it's important that we're there to disseminate information. Yesterday there was some confusion about the governor's declaration, and we got a lot of phone calls. So it's important for us to help in the disseminating of the information to the citizens, because this is new territory for all of us. And so our district offices are there to help. Again, we're not going to be taking appointments or walk-ins, but at the same time, we are manning the phones and emails to make sure that the information is correct and is out there so people can make the best decisions moving forward.
What have your offices been hearing from your constituents in your district?
Well, there was a great deal of concern yesterday, the governor's declaration to shut down essentially non-essential type of businesses, shutting down the bars and restaurants. And so, trying to get the accurate information from the governor's office on what exactly, was this a recommendation? Was this a mandate? And trying to get through some of that was, because obviously, look, I mean, this is people's livelihoods. And if they can't work, if you own your own business, you're not getting paid. And certainly we understand the health reasons, what the governor's trying to accomplish, but at the same time, we're trying to, work with our businesses to make sure that, maybe there's ways for them to still operate, like restaurant doing takeout or doing delivery, things like that they can still, operate a business and pay employees. And, people who live paycheck to paycheck, having a 2-week or more time off can be devastating financially. We owe our federal taxes here in a few weeks, and will people be ability to pay them? Can they even get an accountant to look at them? So these are sort of the things that people are concerned about. It's certainly understandable. The governor's trying to lay out best practices for all of us during this crisis, and we certainly should do everything we can to adhere to that. But at the same time, we want to be able to work with our businesses and our employees so they can not only be safe, but hopefully operate at least the best they can during this very difficult time.
Now, what is your office telling constituents who call in? What advice or what information are you giving them when they call in with these concerns?
Well, I mean, not a whole lot of advice. I mean, we're just, again, getting clarification of the governor's address. I think it was just certain areas of employment that he's asked not to operate, areas of entertainment, hospitality, a couple other areas such as that, non-essential retail. So those are some of the things that we are letting them know. Again, but, I believe the governor is going to be setting up a hotline that if, you operate a business, if you take proper steps, to work with, to sort of adhere to the health requests that the governor is making or requesting, then you can still operate. So these are just some of the things that we're working through with the constituents who are, look, it's a new normal right now, and we're all just trying to do the best we can.
Now, what is the Senate or the House, maybe you're both thinking about it, what specific legislation are you brainstorming to help mitigate the coronavirus spread here in Pennsylvania?
Well, I don't know that there's any legislation at this point for that. We're more reacting to the cause of the mitigation plan. The health experts, the Secretary of Health, and others are laying out the mitigation plan. We're hoping people are able to adhere to it the best they possibly can. And then whatever legislation we will be dealing with, as I mentioned earlier, we'll deal with the ramifications of that, whether they be education, whether they be economic development, whether they be I said labor and industry through unemployment compensation, all those areas. We may need legislation to help people recover or maintain during this very difficult time. But as far as actual mitigation, that's the health experts. We are monitoring, like everyone else, both at the federal level and the state level, the requests of our health experts during this time, and hopefully we can bend the curve as quickly as possible.
What have your thoughts been on the state response to the coronavirus outbreak so far?
I think it's been, very good. I think everyone's working together, both executive branch and legislative branch, to disseminate information, to get out in front of this as best we possibly can. We can only hope in a month or two we look back and say, well, we probably did more than we needed to, but that we bent the curve. We hope that's the case. But the real concern is it spreads, as the health experts maintain that it will, that our healthcare industries, our hospitals, and that will be just overrun. They're overrun during normal flu season, and this is obviously a lot larger than that. So, I think the response from the state has been good. It's confusing at times, and we've had to, disseminate information out there and clarify. But that's understandable during an emergency like this. This is new for everybody. And so, but I think, everyone is putting their best foot forward. There's no partisan, fighting or bickering back and forth. We're just trying to work together, as the people of Pennsylvania would expect us to put the best practices in place so we can get through this.
Senator Corman, thank you so much for your time.
Thank you. Take care.
We're going to be taking a quick break, and we'll be back right after this.
For 25 years, PCN Tours has provided Pennsylvanians with a look into manufacturing businesses across the Commonwealth. Each episode is led by a company expert, giving you an unscripted, in-person experience. Watch what makes Pennsylvania a unique and exciting place to work and the opportunities it presents with PCN Tours on cable and streaming. PCN, Pennsylvania History and Culture.
Our next guest joining us on the phone is Gabe Morgan, president of the SEIU, Pennsylvania State Council. Gabe, thank you for joining us this morning.
Thank you for having me.
So can you tell us a little bit about your organization and what you provide for your members of your union?
So SEIU, our members work in the service sector, both in the private sector and in the public sector. So our members are nurses and social workers and folks who are handling unemployment claims, but also the folks who work in nursing homes, clean office buildings, security officers, building engineers, school district custodians. So we really represent a broad swath of folks who work in the American service sector, both public and private.
And how has the coronavirus been impacting the members of your union? What have you been hearing from them?
I think dramatically. And I think what we see, I think this is really important for everyone to, fully wrap our brains around quicker than we wrapped our brains around the initial contagion of the disease. This is having an incredible impact on working people in this country and a scale that really nothin in this shorter period of time that I'm aware of has. We're seeing our healthcare members are being overrun, understaffed, not having the supplies and the things they need to do their jobs. We're seeing our private sector members in places like airports and office buildings and security officers beginning to experience layoffs rapidly in a scale that we haven't seen before. And then the folks who are working in government in jobs to assist folks impacted by these things, such as social workers and unemployment officers, are also already overwhelmed by what's happening. And we're really just beginning this. And I think, we're deeply concerned that unless there is, as a dramatic economic action now by government to protect workers, what we're going to see here, I think we're already in a recession, but we could see this whole thing tilt towards a depression even after or while the public health crisis is going on.
What precautions are healthcare workers in your union and healthcare workers in general taking against this coronavirus?
I mean, I think all healthcare workers in general right now are suffering a shortage of the equipment that they need to be able to do this work safely, although they're certainly doing it. I think that has been commented on all across the national news. There are not enough masks. There are not enough gloves. There are not enough respirators. There are not enough hospital beds. There are not enough any of those things. And that's why it's so important for people to quarantine as much as humanly possible now. But the economic impact of doing those quarantines and what that really means, I think even now people are not talking about enough, because this is not a country that has a safety net normally in place to handle something in scale and to deal with what's coming. We're going to have to make some dramatic changes. So I think, it's great and that the governor is acting, and if anything, even more action to encourage people to stay home. But the economic impact of that is going to be incredible.
Now, you mentioned that there are economic impacts to this virus. What are those impacts? What do you expect that we'll see here in Pennsylvania?
Well, what we expect is that we will see most workers not be able to work, and that and that this is a country where really very few people, but certainly not hourly wage earners, can afford to miss a week's pay, and we don't have the systems in place to deal with that. And that's why we're calling on government to take action now to double unemployment. For example, if you're making $10 an hour and unemployment is $5 an hour, you definitely weren't making enough money at $10 an hour. There's no way you're making it at $5. If we wait for this to sort of trickle out instead of taking action now, we're both going to exacerbate the public health crisis, but worse, not worse, I shouldn't say worse, as bad. We're going to create this from moving towards a perhaps temporary recession to an economic depression. If most people in this country and so in this state cannot miss 1 week's pay and make their mortgage payment, their rent, or cover any of their other bills.
Are there any other changes that you and your union would like to see to help Pennsylvania workers?
Yes. So what we would like to see is we'd like to see all coronavirus-related disruptions be covered by paid leave of one kind or another. We'd like to see unemployment benefits be doubled again, because if you're making $10, you can't live on $5. If you're making $20, you can't live on $10. And we need to see immediately for healthcare workers bigger efforts to try and get them the things that they need to do their jobs, the protections that they need on the job. Because if healthcare workers start getting this and becoming too ill to perform, then that obviously is going to exacerbate the entire program. We really need the state and local government to act, because I want to highlight to your listeners that the actions that you've heard about the federal government, the sick leave and et cetera, that they're contemplating in Congress and the Senate, which they still haven't passed, will not impact anywhere between 50 to 80% of American workers. They exclude people who work for businesses that have less than 50 workers. And that's the vast majority of small businesses. And then they exclude folks who have more than 500 workers nationally. And that excludes the vast majority of employers in the United States of America. So we're not going to see, at least it doesn't appear, we're not going to see the kind of relief, sick time, or things that people need to both self-quarantine and not become evicted, or the things that healthcare workers need us to do to protect them under the current federal legislation, even if it does pass. We need state and local government to act.
Have you been in contact with state government, with Governor Wolf and his administration to talk about these types of things and what you'd like to see from his administration moving forward?
Yes, we've been talking to them, but a lot of these things will require legislative action. To change the unemployment laws, to pass paid sick leave for folks who work for employers who employ less than 50 people or more than 500, that's going to take the state legislature to act. And and they're not in session. There's a time for small government and there's a time for big government, so we can get back to small government. And this is a time for the government to act in the biggest way that it can in the shortest period of time that it can, so we can contain this and then get back to normal.
How do you plan to work with the state legislature to craft this legislation, to come up with this legislation to help your members and to help workers here in Pennsylvania?
So there's a coalition of 50 unions and community organizations that deal with workers' needs from across the state of Pennsylvania, who are in the process of reaching out to legislators at a state level and also at municipal level. Cities can do some things, but as we know in the state, are preempted from taking a lot of steps. So we're really going to need the state legislature to act. We're reaching out to legislators and asking them to both think now hard about what the economic impact of this will be. We need workers to quarantine, but we also need workers to be able to feed their family, and that's only possible with government action. That's not something the business community can figure out on its own. It's certainly not something that the small business community who are struggling to figure out how to just manage their day-to-day operations can figure out on their own. But we can't wait 2 weeks or 3 weeks if we're going to try and mitigate this. So we're reaching out to state legislators, both in the Senate and the House now, and we're obviously talking to mayors and at a municipal level, particularly in those cities where cities of the first class or second class have a little bit more authority to do something. And we're also reaching out to the administration, and obviously the administration, the governor has been, as he should be, super focused on trying to take the public health steps first to try and contain the virus. And I know many mayors are looking at it the same way, and they should. But unfortunately, we don't have time to wait to take action on these other things. They connect tightly together. If we need people to quarantine to spread the virus, to stop the spread of the virus, and we need healthcare workers to be able to work, then we're going to have to take big government action on economics to protect hourly wage workers and healthcare workers, private and public sector workers of all kinds, so they can actually do the things that need to be done to protect the public health.
And what advice are you giving to the members of your union during this time of this coronavirus outbreak?
So we are telling our members, obviously, to follow all of the CDC rules. We represent, for example, the folks who clean the majority of the buildings that there are in Pennsylvania, schools and commercial office buildings and stadiums and universities. We're doing everything we can to make sure that they are being as protected and doing that work as we can. Union workers have a lot of advantages in the situation that non-union workers don't, unfortunately. Union workers have paid time off of one kind or another. Union workers have paid sick time in general. Union workers have health insurance in general. But most workers are not union workers. And so, we know that these concerns that are impacting working people are not just union members, it's everybody who works.
Gabe Morgan, thank you so much for your time today.
Thank you.
We'll be taking a quick break and we'll be back with our last interview.
PCN brings the distinct aspects of Pennsylvania and its residents to your favorite screen.
Hear from state government and community leaders during unedited, balanced coverage of politics and policy.
Dig into the rich history and culture of the state, presented by notable residents and historians.
Score a view of the best high school, college, and world-class athletes competing across the state, and much, much more.
Start exploring the Keystone State today on PCN and the PCN app.
Now we're going to hear from U.S. Senator Bob Casey, who recorded an interview with PCN's Larry Casper.
We have on the phone Senator Bob Casey, Democrat from Pennsylvania. Senator, how would you rate the way the president is responding to the coronavirus outbreak?
Well, I'm going to exercise forbearance and not give the president a rating because he gave himself a rating, which was a big mistake. No public official should do that. The most important thing here is we all have to take personal responsibility in the midst of this crisis. And obviously for all of us, that means doing what we should do individually to not take steps that could lead to a higher likelihood that we'll pass on the virus if we have it, or to engage in practices that make it more likely the virus will spread. So let's all take responsibility for not gathering in crowds of more than 10, staying home, making sure we're following the advice of washing our hands, using sanitizer, cleaning surfaces, all the things you've heard, and making sure that you're doing everything to protect yourself, your family, and others, because we're not doing this, we're not engaging in these practices just to protect ourselves and our families. We've got to protect others, and that's what we should all be doing in exercising our own personal responsibility. In terms of elected officials, whether it's the president or members of Congress, we got to just act. We've got to take steps like we should today to pass the House legislation in the Senate. And I think we then have to consider what would be a third piece of legislation to help individuals. I would hope we could do more for helping folks in nursing homes and folks with disabilities. We've got to help small business. A lot more to do, but we've got a big challenge on our hands.
Senator, back up just a little bit, please, and tell us about the nature of the legislation you expect to be considered soon.
Yeah, the bill that I think we should pass today in the Senate, not sit on it for the next 3 days. Let's get it done because the House acted quickly. I won't go through all of it, but the main provisions are, for example, providing paid sick leave so that you can have folks who stayed home from work to begin to be made whole. I think we're going to have to do more for them as well. Secondly, to help make sure that if a child has a school meal in school and they're home from school, as so many tens of millions are, that they get a meal. They get enough, more than a meal in a day. That our seniors are protected, people with disabilities. We also have to make sure that unemployment insurance is in place. That's another provision here. So a number of provisions in this bill to help the American family, the worker, and his or her family, her children, in addition to steps we have to take additionally, which I think would be the subject of the next bill, to provide direct help to small business, provide direct help to the economy itself.
Senator, who would be eligible for this sick leave in the bill if it goes through?
Well, this is meant to provide help, especially to employees of smaller businesses. Mm-hmm. We know that there's a gap or a defect when it comes to this particular bill as it relates to employees of larger companies, and we're going to have to provide a fix for that. But it's really meant to begin to do something we should have done a long time ago, which is to provide sick leave and medical leave to more and more American workers.
I understand you're urging the president to expand Medicaid. How do you propose to do that?
Yeah, Medicaid is a health care program that we've relied upon for several decades now, more than 50 years, to provide quality health care to children from low-income families, to help pay for the cost of skilled care in nursing homes. You could almost call the Medicaid program the nursing home program because that's where a lot of the dollars go, and also to provide health care to folks with disabilities, particularly children with disabilities. We've expanded Medicaid recently to cover millions of Americans. I think we should make sure that Medicaid is available in this instance for people that need health care right now. Because one thing we can't do is play around with basic needs that people have, whether that's their food or their livelihood, but also basic health care. So using Medicaid as a vehicle to do that makes a lot of sense.
What's the latest news from the White House, Senator? In other words, any federal mandates?
Well, the White House now is more focused, I think, on providing consistent messages to the American people about what all of us must do, and that's good. That they have a more consistent message. I hope the president will, frankly, talk less and let others do the talking. The professionals who understand these issues best and can provide the best advice, the best guidance, the best warnings. But the administration, I think, worked well with the speaker when they're developing. Speaker Pelosi and the administration were working out this current piece of legislation that the Senate has not passed yet, and we got to pass it. We should do it today. But I think if we can continue in that vein, where you're having collaboration between two branches of government to meet this crisis, we're all going to be better off.
What's the latest on making testing available for Pennsylvanians?
Well, I don't know the current state of how many tests are needed in Pennsylvania. I defer to the governor's team for that. But there's no question that we need a lot more tests in many, many states, including Pennsylvania, because the numbers are obviously going up, and we've got some work to do to make sure the testing is there.
And we've all heard of drive-in testing by now. That sounds like a pretty speedy process. Do you know anything about that?
I'm sorry, what was that?
The drive-through testing most of us have seen on television, right. People driving up and then the window goes down and then something happens. So certainly the impression is given that it's quick and efficient. Can you tell us anything about what's involved?
Well, I haven't seen those drive-through.
Hey, we've got to go, guys.
Locations up close. I just haven't been there yet. But that seems to be working in a lot of communities in terms of providing testing in a safe and expeditious manner. So if that can be deployed more widely, we hope it can happen.
Senator Bob Casey, Democrat from Pennsylvania, thank you very much.
Thank you.
And that is all the time we have today for Coronavirus Impact. Check our website at pcntv.com for air dates and times. You can also find these episodes on our Facebook page and on our YouTube channel. I'm Cass Baker. Thanks for watching.